Patient Autonomy and Informed Consent, a presentation by Cordelia Key, Adam Ramirez, Cameron Dillon, Katarina Sump, and Kelly Miller. Our ethical dilemma regards a middle-aged man that had been declared as mentally incompetent. Due to severe paranoid thinking and dangerous tendencies, he was involuntarily committed to a state psychiatric hospital where his violent behavior was controlled by injectable medications. Though this medication suppressed the patient's violent agitation, his paranoid symptoms remained present. The ethical dilemma became apparent when a new drug was introduced, which, if used by the patient, offered a strong possibility that he could return home. However, the drug was only available in pill form, and the patient's paranoia surrounded an intense fear that someone would try to poison him. To get around this, it was suggested that they deceive the patient by crushing the pill and administering it in his food. Hospital staff received consent from the patient's son, who had been given legal guardianship over him, as the son determined it aligns with the personal values and goals of the family. To expand on this ethical dilemma, we will apply the Giving Voice to Values framework from the core values of honesty, respect, responsibility, and fairness and compassion. Let's start by taking a look at honesty, with a narrowed focus on transparency and trust. Though the medication may prove to be helpful, there's an inherent risk of the patient catching hospital staff crushing a pill into his food. This could, in turn, reinforce his fears and diminish all trust the patient holds for hospital staff, making future hospital visits an impossible task. Moving along, we'll take a look at the core value of respect. All patients should be treated with regard to their autonomy and dignity. However, respecting autonomy and dignity becomes complex when a patient is diagnosed as mentally incompetent. By crushing the pill and administering it in his food, they might be acting in his best interest by offering him a chance to return home. However, they are circumventing his ability to make an informed decision about his care. While the son has consented to this approach, we must ask, does this consent honor the father's autonomy and dignity, or does it prioritize the family's values over the patient's right to self-determination? Furthermore, does the act of deception itself undermine the patient's dignity by treating him as if his perception of reality does not matter? Next, we will touch on the core value of responsibility. More specifically, the ethical obligation of the caregivers as conscientious moral agents. The conscientious moral agent is someone who is concerned with the interests of everyone who is affected by what he or she does. How could hospital staff deceive the patient with regard to his best interest? With the obligation to do no harm, does the potential benefit of the treatment outweigh the potential harm of violating the patient's trust and autonomy? With these questions in mind, the hospital staff has a duty to ensure they are acting in the best interest of the patient, not just based on the wishes of the legal guardian. Finally, we move on to the core value of fairness and compassion, with a focus on impartiality and patients' rights. One of the central tenets of fairness is impartiality, or treating all individuals equally. In this case, impartiality would require staff to consider the patient's right to make informed decisions about his care. If the patient were not mentally incompetent, would it still be acceptable to deceive him about his medication? Could the act of deception be viewed as discriminatory? Compassion, on the other hand, calls for us to empathize with the patient's experience. The patient's paranoia is still his reality. Compassion demands that the treatment aligns with his needs, rather than simply focusing on what might be easiest for the hospital or the family. In this ethical dilemma, the son has the legal authority to make decisions on behalf of the patient. His consent to administer the medications is based on what he believes is best for his father, guided by family values and personal goals. This can reflect the theory of ethical subjectivism, or the idea that our moral opinions are based on our feelings and nothing more, eliminating any such thing as an objective right or wrong. Another angle is ethical egoism, or the idea that each person ought to pursue his or her own self-interest, such as facilitating the father's return home without considering the moral impact on the patient. However, ethical egoism does not mean you avoid helping others. Sometimes, your interests will align with the well-being of others. By choosing to deceive his father, the guardian may rationalize that doing so is not only in his own interest, but also in the interest of the patient.
After discussion, we as a group decided that it is not ethical to deceive patients. The reason for this is because treating a patient who is already paranoid of being poisoned by slipping medication in his food just cannot be justified by the goal of just getting him out into the community. The staff should build trust with the patient rather than resorting to deceiving him, which could destroy any type of trust that the patient might have with the hospital staff. Because let's say the patient were to find out, it would reinforce his fears, his paranoia, and just make it impossible for him to ever want to visit a hospital again. However, we came across this challenge, and it was this question: when is it okay to make decisions for mentally ill people? And to be honest, we came to the decision that it's really never okay, unless they are mentally incompetent and physically cannot decide for themselves. Other than that, the patient should have every single right to make a decision on their own behalf. The main lesson we take away here is that honesty and respect should drive all relationships between the hospital and the patients. The reason for this is because all patients deserve the right to decide what happens to their own body, because there could be underlying trust issues like there was in this case. And because of that case, we learned that honesty should drive all decisions in the hospital out of respect for the patient. In conclusion, all people should have the right to their own body. However, if for any reason the hospital staff should override the choice of the patient, they need to be careful because the patient could potentially harm themselves or others. Because at the end of the day, like we talked about in the framework, it comes down to honesty, respect, and responsibility, and fairness. The following references are the citations in APA format that we used for this presentation.